The Community Care Center of the Northeast is located in Philadelphia. The center was founded by Jean Lagenbach 33 years ago. Their Wheels for Independence program provides door-to-door transportation for those who are unable to get to their medical appointments.
I'm Jean Langenbach. I'm the founder and the director of nursing. I'm a registered nurse with a bachelor's degree, and I've been doing this for 33 years. And was led to help the elderly by a book I read by C. Everett Koop, who used to be the Surgeon General, of where our health care was going for seniors by the year 2015. It was not a pretty sight.
Over 3.6 million Americans have transportation issues that prevent them from receiving necessary medical care. Often, the poor transportation infrastructure in many low-income neighborhoods makes the system unreliable for many people.
I realized that transportation was becoming a major issue in the healthcare field. People were not getting to their doctors, they were not eating properly, they were not getting to the pharmacies and specialists. So needless to say, they were making more and more visits to the hospital, which doesn't help our economy. So if we could handle it at home and by help through the neighbors, we'd be in better shape. So we stepped out, wrote a grant, got a van to start out with, and that was just the tip of the iceberg. And now we have well over 25 volunteer drivers.
The drivers mainly consist of recent retirees who want to give back to the community. The Wheels for Independence program provides over 200 rides every week.
In order to get to the primary doctor, many times their cognitive ability does not allow them to call a taxi, or whatever. So the families actually set us up as part of the program, and then they call us, the family and or the client, and say, look, I need a doctor's ride, I need to go to the specialist, I need, whatever. And we make those appointments and we send somebody.
Members of the center will call either 1 or 2 weeks in advance to schedule a ride.
Many times they stay with them in the waiting room. If they want, the driver will go in with them. If they don't, they understand that and they wait. And then there's none of this calling and nobody shows up. They're there, they stay.
The center is a nonprofit organization, so they do not receive certain funding. Lagenbach went out and received a grant from the First Hospital Foundation to buy their van. Since they are not a state-run organization, the center had to follow certain regulations such as insurance before starting the Wheels for Independence program.
It's more complicated in a lot of ways because we have to not only meet the client's personal needs, and their families now get involved because many are from other parts of the United States. They call us from California, Florida, anywhere. We understand their parents live here. Could you help mom or dad? So we become their member of their family as well. So we've been able to keep them out of the hospital, maybe get their doctor on the phone and do something before we make the big move where they would have been going to a hospital for something that maybe could be treated just by a simple phone call.
There are over 300 members of the center, and the number is constantly growing.
And they really appreciate it. The letters and the phone calls we get every week is just incredible of how glad they are to have this volunteer who not only takes them to the doctors, but goes in with them. We've been, around for a while. People know us in the neighborhood. And that just takes us to a whole other world of training people to do all this, but it's needed. And there's lots of people popping up with these businesses, but they don't do all this. They don't do transportation.